Good morning, everyone. This is Kimberly Grudel from Fremont Bank. I want to welcome you to our Business Alliance meeting. We have a new program for today. We are in coordination with the other chambers in the Tri-Valley. We have Inga Houston, CEO from Dublin Chamber of Commerce.
Good morning.
Steve Van Dorn from Pleasanton Chamber of Commerce.
Good morning.
Good morning, and Dawn Argula from our very own Livermore Valley Chamber of Commerce.
Morning.
Today's program, we're featuring our Alameda County Public Health Department, Dr. Nicholas Moss, who is our interim public health officer. Welcome.
Thank you.
Dawn, did you want to take it from here?
Yes, so thank you, Kimberly. We do have a new format today, and we are featuring the public health officer and our guidelines and indicators and an opportunity for some Q&A. Dr. Moss will be leaving us for a 9 a.m. meeting, so we will make the most of the time that we have with him. So for the Livermore Valley Chamber members, we will be circling back with you later in the month with another meeting where we will resume our regular format. So first of all, if any of the chamber CEOs have a comment that they'd like to make before we get rolling with Dr. Moss. Inga, you're on mute.
Good morning, everybody. Thank you for tuning in. Thank you for Dr. Moss for taking the time to spend with us. And we really look forward to your comments and learning what we can do to support you and also get our businesses open.
Good morning. Thank you, Dawn, for including us in this very important meeting. And I want to congratulate Dr. Moss on his recent appointment. It's a tough job, but we look forward to supporting you. And as Inga said, we really want to work with you and your team and making sure our businesses open safely when we get the green light to do so. So we really appreciate your time because I know you just stepped up in this new role and look forward to the discussion today. Thank you.
Okay, very good. So with that, I think we'll get rolling with Dr. Moss. Welcome.
Well, thank you. Thanks, Dawn, for inviting me, and thanks to the Livermore Valley Chamber and also to the Dublin and Pleasanton Chambers for having me. We really appreciate the opportunity to reach out to your chambers and to your constituents and you know, have these kinds of conversations. So I hope it's useful for everybody. And I'm going to just start with really a small number of slides because I imagine there's lots of questions and discussion that we're going to want to have, and I want to leave lots of time for that. And just so people know, Eileen Ng from our Healthcare Services Agency, one of my colleagues who does a lot of work with employers and supporting the recovery process and across the county, is also joining us. And so you know, sometimes she'll have answers to questions that I don't have, and for things that it's more just about us hearing from you all and taking back and maybe coming up with you know, answers later. She'll also help with that. So I'm gonna just share my screen here, and I'll make sure that I don't know if am I able to share a screen? I'm getting a little error message here. Host disabled. Participant screen sharing. Let's see.
Jody has to do that.
Okay. Let's see if we can.
I'm sorry, I'm working on it here.
So, well, I'll just get started and say a little bit about our role at the health department. So, this is, you know, I've been working in public health for about 10 years. After my medical training, I'm an infectious disease physician. I have a master's in epidemiology as well. So that's my background, but about 10 years in public health, a lot of that in the HIV world, and then more recently in this sort of broader disease control across many different types of diseases. And so our role at the health department is really just to slow the spread of disease, protect county residents, communities that are heavily impacted, try to protect the healthcare infrastructure, and ultimately protect people from getting sick or even dying from COVID-19 and from a range of other infectious diseases that are of public health interest. There's a long list, about 80 that have to be reported to us by law, and we respond to and try to reduce the risk of spread. But this is obviously a scale that's few people in my field have encountered. Maybe the HIV epidemic, H1N1, and going back further, polio, and of course 100 years ago the Spanish flu. But really quite a historic pandemic. So absolutely, we have a big role in this. But again, it's for public health departments to be effective, it's about partnership with community and business leaders like yourselves, and really all sectors of society to have success. So
You should be able to share screens now, Dr. Moss.
great.
How about that?
Okay, we'll stop extemporizing here. Okay, can people see this screen? I'm seeing some nodding.
Yes.
And let's see if we can get to a slideshow view. So again, just a handful of slides. I started speaking about our role more broadly, and I would, for the COVID pandemic, we have some specific things that we're trying to do. So it's prevent and control the spread by minimizing community transmission, and also just protecting the highest risk populations. And in particular, older adults who are disproportionately impacted by severe disease, where we see the deaths, the common denominator is really age, and also the disproportionate impact on communities of color, particularly where people are frontline or essential workers and have not been able to achieve the same kind of social distancing because they're going back to work and often living in crowded households as well. So that's really where we've seen our epidemic unfold in Alameda County so far. It changes over time. How do we do that? Well, we do our regular work of investigating reported cases of illness and contact tracing. It's been in the news a lot. That's to help people who are infectious or might become infectious really stay home and just for a short period of time until they get out of that infectious period if they're sick, or we know that they're unlikely to develop infection if they were exposed, so they can protect their family members and their neighbors. We also want to make sure people who have COVID, that there's capacity in the healthcare system, hospitals, intensive care units, to care for them and to care for everybody else who has health problems. So we have a role there. And we just also want to make sure that people we are asking to stay home or stay where they live, that they have whatever we can do to support them through that process. Maybe that's food, maybe that's a hotel room in some cases. We have an important role there. And finally, just a coordination and communication role, making sure that people across the county understand what we're trying to do and that we can build cooperation for getting there. A really big update is, you may have seen this in the news this week, we paused our reopening. We have increases in hospitalizations in Alameda County. We have increases in reported cases over the last 10 or 14 days now. Similar increases are being seen across the region and across the state. This is not an Alameda County thing. It's really a much bigger issue, and in fact across the country. So what this meant, our last phase of reopening was back on June 19th. Outdoor dining, indoor retail were some of the big changes there. And we were aiming to try to reopen things every 2 to 4 weeks based on what we were seeing with the epidemic. And now it's more like 4 to 6 weeks. So we're not moving backwards at this time. We don't want to move backwards. We'll talk a little bit about what that might mean. But we do need to go slowly. And so that's really what the pause on reopening means. And so just, you know, why the pause? So this is our new cases reported by day in blue lines. You can see up above 100 at some of our busiest days. And actually it's, I think we've had some days where we're up to 160 or so. And it looks like it drops the last few days, but that's only because the data takes a while for us to kind of tally everything up and get everything entered in the computer system. So believe me when I tell you this, you know, increase continues. These are our hospitalizations, and it's an average, the 7-day rolling average, so it kind of smooths out all the rough edges in the curve. You can see there's an increase at the end there. And again, that also has continued day in and day out. We're seeing more people in the hospital in Alameda County. All of this information is on our County Public Health Department website, a little bit of an older website, so it takes a few minutes to familiarize yourself with the layout. There's a lot on there, sometimes too much, but if you go to our dashboard, you can see some of this data. And up in the corner of these boxes, there's a little button. Sometimes it's hard to see. You can expand the box and take a close look. We have a lot of information up there, and it's pretty current. Usually it just takes a day or two for stuff to get fully entered. So when we get information like that, how do we use it to make our decisions about reopening? Well, this is our indicators for what's going on with the pandemic locally. These are have been adopted by all of the Bay Area counties, and they're similar to metrics that the state of California follows. And the state has a really big role in reopening and closing of businesses, which has also been in the news the last few days. So we follow cases and hospitalizations, as I mentioned, and also how many hospital beds there are free in the county, what we call surge beds. That's like if the hospital's full and they start having to put people in the hallways, how many can they, you know, how safely can they do that? How many beds can they add safely? About 900 for the county is our working number for surge beds. So we monitor those because we want to know, you know, if our hospitals are able to take care of our most ill patients. As you know, many people with COVID have very mild symptoms or no symptoms, but when people get sick, they get very sick. We also want to make sure we can test. This is one of the areas where we've done really well under the leadership of Dr. Jocelyn Freeman-Garrick from our Emergency Medical Systems office, and almost 3,100 tests per day performed in Alameda County. That's our goal. A lot of that is done by healthcare systems, but some of it's done by community testing sites that we help coordinate. Sufficient disease containment, that's where we have staff who can do contact tracing on all these cases that are reported. And then personal protective equipment. We want to make sure that hospitals and clinics and other people who need it, first responders, that they have access to like the masks and face coverings that they need to do their job safely. Because if they're scared that they're not going to be safe when they do their job, then it's really hard for them to do their job. So that's a real key indicator for us. So we follow these. When these are stable or reassuring, we feel good about reopening. When they're not, we have to move more slowly. Alameda County, already one of the slowest moving counties in the state. I would say that these boxes, 5 is good, 1 is bad. You know, we probably need to update this slide and make this cases and hospitalizations 2 from 3, 2 boxes. And disease containment, you know, it's hard to keep up right now with the number of cases. And so we are adding staff like crazy. We're moving to more efficient systems, but you know, the pandemic moves very fast. So this is where we are with reopening. We paused in between this yellow circle and this blue circle. And that last yellow circle, 6/19/20, that's not that long ago. So we wouldn't even be quite at our next phase of reopening at the earliest without, you know, slowing things down. You know, the hope would be to that things will stabilize and we'll be able to move to this next phase: indoor dinings, some personal care services, pools, that sort of thing, with our next phase of reopening. As we learn more about where the greatest risk is, some of these things can move around and we might delay longer on something and move something up faster. For example, outdoor activities really seem to be much less risky than indoor activities. As we learn more about COVID, that seems to be the case more and more. So I think this is a good point to mention that the state has really driven a lot of the conversation about sort of which sectors and businesses can reopen. And we, for the most part, can't get ahead of what the state is allowing. And the state monitors counties that are most impacted and is now, just starting really this week, starting to mandate that counties that are most heavily impacted, that they actually shut down some activities. So you might have heard about bars being closed down in certain counties. That was in the news this week. I think the state is going to announce some additional indoor activities today that need to be pulled back in some places. So far, because Alameda County has moved slowly, I think the impact of that on us will be more limited than on some other counties. And we're not officially being monitored by the state yet, but I think it's only a matter of time. This is just when the decisions are made about which sectors could be, reopened when. It really has to do with risk. And again, indoor, outdoor is a big one. How far apart people can be spaced. How easily a place of business can adopt measures to protect their staff and customers. So Eileen and our COVID recovery team at the county has really been doing a lot of outreach, making guidance available. There are some things we ask of businesses that are reopening. They put some things on paper that are what we call a site-specific plan to protect workers and customers. And that has to do with physical distancing, some individual control measures, making sure people who are sick don't come to work, face coverings, cleaning, and beyond this, we're really working on supporting businesses who do have a case or cases of COVID in their at the workplace. We have a webpage on this with a lot of useful information. There's an email address, covidrecovery@acgov.org, that businesses can use to reach out or to let us know if they have cases. Again, our website with lots of resources. I think we can talk about this in our discussion, only to say that COVID's going to be with us for a while, and some of these things are going to be with us a while. The better we do with some of these individual and business level interventions, the less we're going to have to do this kind of blunt instrument, shelter in place kind of stuff. So that was all I had for slides, but happy to answer as many questions as I can.
Thank you, Dr. Moss. So for those that are watching, we do have a Q&A and a chat feature on your Zoom screen, so you can go ahead and submit some of your questions that way. We have 10 minutes left. No, wait, we have 40 minutes. Oh, okay, yeah, we got lots of time. So do submit your questions. I do have some that were sent ahead. There is one here that I noted. So a question was, if someone has been exposed but is not showing signs of COVID, are they okay, or do they need to quarantine, and for how long?
Yeah, so our threshold for calling somebody a close contact, we use the CDC's definition based on, the best available information we have at COVID, is if you were within 6 feet of somebody for 15 minutes or more, particularly if that person was not wearing a face covering, that would be considered close contact. And the greatest risk is people who are household contacts, close colleagues in a tight quarters, like kitchen staff working in a closed kitchen, healthcare providers, intimate partners. Those are really the people who are most likely to get it. But 6 feet, 15 minutes, that's kind of our threshold for saying you're a close contact. And then for those people, it's a 2-week quarantine, so stay home, don't go to the store, you know, don't, you know, protect your own household members, try to use separate bathroom, separate bedroom for 2 weeks. And, you know, we know that's a heavy lift for a lot of people. It should be considered sick leave from a business standpoint. We really encourage businesses to have flexible leave policies to allow this. I will say that masks and face coverings really, we in some settings, we factor that in terms of trying to determine if somebody is exposed or not, particularly in healthcare settings. For the general public, they will protect neighbors and family members. But the 6 feet, 15 minutes is kind of the rules we use for close.
Okay. And when should they, if you were exposed to someone who tests positive, when should you test? And how long before you are safe?
So that's a great question. That 14-day quarantine applies regardless of any test results. So testing is very useful for people who are sick. And then we do want people who are exposed. We're now recommending those close contacts that they get tested. The best time frame to do that isn't quite clear yet. It's probably a few days after the last exposure. You see different guidance out there. If that test is positive, then that you know you have COVID, and you kind of move into the infected isolation box. If that test is negative, you still have to quarantine because it can take up to 2 weeks to get sick. And just because you tested negative in the first couple of days doesn't mean you won't go on to get sick. So it doesn't replace quarantine. We do recommend it now for close contacts if they can get tested safely. And again, the time frame for that's a little squishy, but it can take a few days for that test to turn positive if you're going to go on and get sick.
Okay. Thank you. And I just want to note that this webinar is being recorded. So if you missed something, we're going to post it, and you can refer to it later, and we'll send it on also to Dr. Moss and his staff so that they can note any comments or follow up on any questions that we're not able
or make any corrections if something go wrong.
Correct.
I think I have most of my facts right.
Okay. So, you know, we do have performing arts theaters, and we have a couple of movie theaters out here, actually more than a couple throughout the Tri-Valley region. Are there any indications whatsoever or advice or guidance that you could give them at this point that they could possibly prepare or maybe pilot, you know, an event, you know, if they remove seats or, you know, limit the number of folks in there, anything at all that you could advise this industry on that they can at least begin to prepare? I don't know if you've got some kind of an idea on a timeline. My sense is probably not right now, but anything.
Yeah, we're not putting timelines on just because we're you know, because we're not 100% sure where this current increase is going to go, and because also the state is pretty heavily leaned in right now on indoor activities, and so you know, it's difficult for us to get ahead of the state. They have some levers to pull and kind of prevent us from being you know, from doing things that they're trying to limit statewide. So I think timelines, it's unclear right now. The big things that are going to be part of any reopening plan for those indoor kinds of spaces are really how well can you space out patrons. So yeah, I think that's right. Blocking off some seats so that people are spread out from each other. Now, you know, I go to the movies. I love going to the movies. I go to the movies with my wife, and we sit together. So I think it's, you know, finding a way to accommodate households that are allowed to be together, but keep separate from other people. So maybe it's, you know, 2 seats together, but you have to be household members to have those seats together, and then closing some seats down. And that means running at lower capacity, which I understand, you know, hurts the bottom line. And then it's going to be being very strict about face coverings. You know, I know some people don't like them. Some people have problems wearing them. I know people feel like it's a little bit of, you know, I know it's hard for some people, but I think it's real important for businesses to be, you know, asking their customers to wear face coverings so that, you know, that their customers can feel safe. And I think that's going to be really important when the time comes to reopen some of those, particularly those indoor type spaces where people are going to be for, you know, more than 15 minutes. And Eileen has worked pretty closely with a variety of businesses. You know, we try to adopt best practices, learn from what's going on in counties that have attempted to or have gone on to reopen some of these kinds of places. So we're more than happy to help, you know, provide post guidance by sector. I don't have, I think the big principles are the most important: separation, face masks, and also good cleaning. That's going to be really important. You know, maybe letting you know, between shows, letting a theater have some downtime just for the air to recirculate, settle down.
Okay, thank you. And then Eileen posted some information in the chat room regarding family entertainment and movie theaters. So these are guidelines, and these are things for you to begin to think about and prepare for. We have, by the way, our Recover Livermore page posted on our livermoreupdates.com website, where we have all of our industries and the guidelines that have been produced so far from our public health officials. And we'll be sure and add this there as well. But just because the state has the guidelines and the county has not, you know, yellow lighted or green lighted that activity yet, this is merely information for the industry to begin to prepare. That's my understanding, Dr. Moss?
That's right, yeah.
Okay.
And I didn't mention before, you know, lines for all of those settings. You're going to want to think about how your customers are going to be lined up to get in, lined up for snacks, those kinds of things. You've probably been through this at the grocery store, but 6 feet of distance.
Okay, very good. And then on the face coverings, Dr. Moss, so the state now requires face coverings statewide. So this is not an optional, you know, choice. They are required when we go out. I know there's certain circumstances where they're saying they can be removed, but I mean, the default is face coverings are required. Are we clear on that? Yes.
Absolutely right. Face coverings are required, and they're required because they work. They protect your family, they protect your neighbors, they protect your, you know, older adults in your life. And the more we use face covers, the more we kind of keep our physical distance from each other, the more we can keep things under control, so we can kind of get back to some, you know, semblance of a more normal life.
Okay. I just want to be crystal clear on that, because our businesses, the business community, and I think my chamber CEOs would agree with me, have already been deeply affected by the impacts from the virus, and have made many sacrifices already. And so they want to operate safely for their workers and their customers. And I think that the business community will definitely take a stand on that. And love to have your business, but if you're unwilling to comply with the face covering requirement, we'll just have to see you post COVID-19. And I think probably the majority of the businesses would agree with that, because there's a lot at stake here for the business community. So we've got lots of questions coming in. I know I have several from the wine industry, and there seems to be some questions about the requirement for food service at the wineries in order for them to operate, and that it does add another layer of risk, exposure, expense. Is this something that will continue? You know, I know wineries per se were further out in the reopening schedule. But can you talk about that?
Yeah, I think, yeah, in broad terms, and I know the regulations are thorny, and there's the state, I think it's the Alcoholic Beverage Commission, you know, they have a regulatory authority over licenses, and they have their own, you know, set of rules that we have to work around. So we've, you know, what is currently allowed in Alameda County is outdoor dining, and some of the, you know, the issue with beverages is tied up in how the outdoor dining works. I certainly understand it, you know, if I understand the question rightly, it's kind of getting at whether that presents an added risk by introducing outdoor dining and people coming into outdoor dining. And, you know, we do think outdoor dining in general, we think is relatively safe compared to indoor activities. So that's the most important thing. And we wanted to be able to, well, I'm making it sound like, you know, we're seeking to reopen things in a way that's safe. And I know that there's avenues within state and local regulations to allow people to do that for outdoor dining, but I know that it's complex. And you know, I think we still feel confident that outdoor activities are relatively safe, even if there's eating involved. There are some specific rules that should be, you know, applied, like you know, only members of a single household, tables or eating spaces should be a certain distance apart. And so so there are some measures that should be adopted with eating to ensure that it's as safe as possible. But right now we don't have a we're not yet at a place of opening non-dining outdoor you know, wineries, bars, things like that, and I think I could understand why there would be interest in that. You know, there's an issue with drinking establishments nationwide and certainly statewide, and the state's taken a very directive approach to bars. So we're still kind of learning what that's going to mean for certain types of establishments and where the exceptions might be. So that may be what the question's getting at, like when can we serve wine at our winery outdoors without food attached to it? And you know, I certainly understand that. It's going to play into our overall reopening strategy, which, as I said, we're moving real slow right now.
Mm-hmm. Okay. And I have one last question for you, and then I'm going to share the Q&A with my other panelists here, because a lot of questions are coming in hot and heavy here. But this has been a burning one for some weeks, and this is from our fitness and wellness industry. Razi Hasni, he has Joya Yoga here in Livermore and Dublin, and I think some other locations. And the fitness and wellness industry has been severely impacted by the closures, and given recent studies that have shown the effectiveness and safety of fitness facilities, what are the chances that the facilities can get a variance to open with limited operation?
Yeah. Yeah, I understand. I mean, the impact on the impact on you know, the fitness industry has been profound, and I think we in public health really don't want to be in the position of, you know, we'd love to get away from having anything to do with what types of businesses open and close, and really we want to focus more on what types of actions are necessary to protect people's health in a variety of different settings. Outdoor fitness is allowed. You know, we certainly encourage people to look at the, you know, what kind of activities are currently allowed and see what they can do to adapt. I know that's easier said than done. I'm not a business person. You all are the experts, and I'm sure there's a lot of challenges to doing that. It's 100 degrees. And you know your customers are going to want to go meet outside, any number of things. So I don't mean to suggest that these are easy solutions, but we really want to get to a place where we're talking more about, if you do X, Y, and Z, you're doing the best for your customers and your employees to protect them, and just try to work within those rules and get away from this industry and that industry. You know, isn't ready to reopen. And we've been a little bit tied to the state on some of that kind of sector by sector approach. And we're exploring ways to get away from that. Doesn't mean it'll be any easier, but it might mean it's more like, what can I do with my business to adjust and make things as safe as possible? And not so much, I'm a fitness business and I just can't operate right now. But yeah, I know that industry has been hit very hard, and our decision making is really focused on what's going on with the pandemic and what we can do to keep people safe. I know maybe doesn't provide much comfort, but we're really not trying to do it industry by industry. And so, or rather, we're not. We don't want to tie it to any one specific business sector, but more about what we think can be done safely and to continue to protect public health. And so that's where we are.
Thank you. So I'm going to turn it over to Kim Grudel to ask a couple questions, and then Steve and Ingo jump in there. Got plenty to go around here.
Good morning. Thank you, Dr. Moss. We have a question from Philomena Rambo from our school district, and she's asking what PPE, distancing, and health protocols do you feel are necessary if we are to reopen schools?
Yeah, so school reopening is a big topic. We could spend a whole conversation on that alone. We are strongly in favor of finding a way to get schools open safely, safe for students and their families, but also safe for staff. If staff have to feel like they can be at work safely. And we're learning a lot about kids and COVID right now. Data is sort of coming out every day. And it's, first of all, kids, except for very, very young children like infants, newborns, kids don't seem to be as impacted by severe disease in general. And the big question is, how likely are they to pass it on to each other, to their teachers, to family members back home, particularly older adults who may be at risk of severe outcomes. A lot of that data so far is reassuring. So we are, trying to get to a place where we can reopen schools because it's really important for economic reasons. I think everyone knows, to be able to have kids be able to go back to school so parents can work. And also it's really important for kids, for their health and development. So we're really about trying to figure out a way to do that. We do have staff at the health department working with the Alameda County Office of Education on safe reopening. We're looking at what some other counties are doing. We would like to get to a place where we're reopening in a way that's safe, where there's distancing in place and there's measures to protect staff. That's going to involve some combination of what I've been talking about: distance, physical distance, maybe lower numbers, or arranging the school week in a way that there's fewer kids in the classroom and on any given day, and face coverings. And so that stuff is all a bit in flux, but it's going to involve, it'll definitely involve probably face coverings, maybe face shields or transparent shields in some cases, symptom screening, maybe at home by the families. It's hard to ask schools to screen 100 children every morning at the start of the day. We understand there's some practical challenges there. And then I think monitoring closely to make sure that it's happening safely, so that, we start to reopen and things are reassuring, then we can, we can feel pretty good about keeping schools operating. So it's very much a priority right now to figure out how to do that.
Thank you.
I'll try to go faster. I know I speak a lot, so
That's
I want to get to more questions.
Right, so Jeannie Haig was asking, she's heard of many people, including herself, who had similar respiratory issues within the last 6 to 7 months, but all tested negative for the antibody. She hears there could be many strains of COVID and tests may not detect this particular one. How confident are you that the antibody tests are showing the results you need?
Yeah, great question. So we do not recommend using the antibody test for diagnosis. If you think you might be sick, the antibody test, not quite there yet. They're getting better all the time, but they don't really detect infection accurately until a few weeks after infection has happened. So we really recommend that people get tested with that, nasal swab test. Sometimes it's a mouth swab that looks for the virus itself. They're called molecular tests or PCR tests. They look for viral genetic material. That's the most important thing for clinical use. Those antibody tests are useful from a public health standpoint for understanding maybe how many people were infected over time. It's still probably, in Alameda County, it's going to be maybe 8 to 10% of the population at most. So we're still really in the early days of this. And there's a lot of other viruses that circulate that can give people colds and make them feel sick. And so certainly not surprising that somebody would have had, a respiratory illness and that they didn't have COVID. It probably wasn't really circulating that widely in Alameda County before late February. And so, that's not too surprising. And if you're sick or you're a close contact, those molecular tests that look for the virus itself are the best way to go right now.
Thank you. And then we'll take a couple questions from our panelists.
Can I-
Inga, you had a question?
Kimberly, can I one last thing about
Sure.
those antibody tests? We'd like to believe that if your antibody test was positive, that meant you were immune, but we also don't really know that yet. It's a little too early to say. So just one other thing about antibody tests, it's real early on, and we're not quite at the place where we can say, oh, you've had it, you're off the hook, you're not.
Okay, this is Inga with the Dublin Chamber. There are lots and lots of questions that we'd love to ask. I know we're under a short period of time, but I'm going to take my mayor's one first. He is asking about outdoor swimming pools. Are they safe? Does chlorine kill COVID, and does water dilute COVID? Can we swim safely, especially perhaps at HOA swimming pools?
Yeah, so I know there's a lot of interest in getting pools opened, and I think it was probably in our next, wave. I'm back on that list that I showed you, our sort of next wave of things to reopen. And so the time frame for that is hopefully, before summer ends. But again, we're kind of looking to see how the next week or two plays out. The issue with pools really is that public pools they're congregate settings. People are getting together. There's a lot of surfaces that people are touching. It's not so much that we think it spreads in the water, it's much more about like groups, families sharing that space, and how well can they spread out? How well can we limit interactions? Because it's those groups of people together that are closely packed, particularly with, it's hard to use face coverings. I think if you're coming in and out of the pool, that's really the concern there. But I think we're hopeful that if things settle down and stabilize, that pools are on the horizon for getting open, probably with some modifications, maybe, closing indoor parts of the facility, making sure that there's adequate space between families and those kinds of things.
Thank you. And then I hope that answered the question, Mayor Halbert. I have a question that I'm not seeing posed, but I think is quite important. Say, for instance, your business had an exposure. Where can we find guidelines for reasonable disinfection to return to business? I've heard some businesses use like a hazmat style, like medical level disinfection, which is extremely costly. Is that reasonable for an office or a retail? And where can we find guidelines for, I know we have opening guidelines, but what would be a exposure sanitation?
There are cleaning guidelines out there. I think you can get to them through our COVID recovery webpage. You could try to just search for COVID recovery. Eileen may post something in the chat box here, but there are cleaning guidelines available for businesses. And I think I just point you to those guidelines. It should be manageable.
And then my last question is, the CDC did I not hear that they said face masks are not effective, but the state and the counties are requiring that? How do we respond to comments and concerns over that non-alignment?
I don't think CDC says that. I think CDC is in favor of face masks.
Okay.
In fact, we're looking to see some more strict federal guidance around this. That it's been a little bit slow in coming, but I don't think that's accurate information. I think that face masks are supported all the way up to the CDC and as you know, required in California.
Okay, so that's more of a rumor, so that's how we should.
Yeah.
Okay.
I mean, go to the CDC website. There's a lot of stuff on there, but with a little bit of minutes digging around, you can see information tailored to the general public, and it's pretty useful.
Okay, fantastic.
Okay, my turn. Thank you, Dr. Moss, for your time once again. So there's, as you probably know, there's been some questions about the Tri-Valley per se versus the rest of Alameda County and treating us as a sub-region. Can you talk a little bit about the testing results in the Tri-Valley? And then also, there's people that travel to Contra Costa, they go right across El Costa Boulevard and they're in Contra Costa, so they don't know where they're going. So it's very challenging to talk to people and for them to understand the differences in going to San Ramon versus Dublin and Pleasanton and Livermore. So could you talk a little bit about that and get your thoughts on that?
Yeah, and I want to make sure that we have a good conversation about this because I think this is an important topic. And we meaning the sort of whole public health universe, state, federal government, we have asked a lot of the public to try to work around these kind of regional differences and county by county approach, and the rules are different in Contra Costa and all that. I mean, that is not really fair, I think, to the general public, and I think it's unfortunate that that's kind of how things have played out. Early on, the Bay Area counties were really in strong alignment in terms of our measures to prevent the spread, and that was extremely effective. But of course, counties have moved at a different pace in reopening. I think, and that continues to change. Now Contra Costa is having to, look at areas they might need to roll back and slow their own reopening because, we see that the more things are open, the more spread you have, and we're seeing COVID move into sort of younger populations and things like that as people are more active. And so, what things looked like 2 weeks ago is different from how these look now in terms of, crossing over the county lines. But anyway, so I want to acknowledge it's really been asking a lot of the general public. In terms of the Tri-Valley region, so yeah, if you look at the map of where the highest cases by residents are, they're in other parts of the county. But remember, people are going back and forth. Customers are going back and forth between different parts of the county, and workers are going back and forth between different parts of the county. So when we think about limiting the spread of the epidemic, we want to know where people are living who are most impacted, but it doesn't mean, and we want to make sure that there's testing available and services available, but it doesn't mean that we can sort of reopen different parts of the county and just assume that there's not a shared epidemic there. And so, I understand if you just look at the map, you think, well, we're not affected, why don't we open? But I think you have to factor in that people are coming and going all the time between those areas, and very similar to, I think, the difficulties we've had regionally with other counties being in different stages of open. It's caused as many problems as it's solved, I think, in some ways, and it hasn't really led to controlling the pandemic as well as we would have liked. So I think we can't just tie it to like the case rates in one zip code or several zip codes. And then And what I'd much rather have is get the whole county to a place where we can keep reopening. And so that's really what we're trying to do. You know, so that's where we are with the sort of regional issues.
And if I could ask one more question, this came up when Nate Miley held a webinar recently. And we appreciate all the testing that's going on at the Alameda County Fairgrounds. Is there tracking being done of the people that are being tested? What's the percentage of those testing positive versus not testing positive? There doesn't seem to be statistics that were able to be shared at this webinar that we had recently on that. I think that's important, and I know a lot of our city council members are interested in that. Can you talk about that for a few minutes?
I'll show you what we have right now, which is not specific to the fairgrounds. We just have for the whole county. We do have data on testing up. We're trying to add data all the time to our webpage, and so I don't know if people can see this. I'm trying to. So this is our dashboard. Up in the corner, there's a button to take you to page 2, but you can also find another link to page 2. Again, we're working on improving this so it's a little easier to find. So right in the middle, this is our total test, rolling 7-day average. And then you click here and you get positive tests. So this is all tests reported in Alameda County to the Public Health Department, not just fairgrounds, all sites. This is about 4% positivity. Again, the last few days, the data is still getting kind of entered, but we're at about 4% positivity overall. So overall in the county, all comers, all sites, 4% of tests are positive, and that's not terrible. We'd like to be below 3%, but it's well below the state's concerning threshold for test positivity. And it'll be higher in places like healthcare facilities that test more symptomatic or sick people, and it's going to be lower at places that kind of test all comers. And I don't know what the positivity is at the fairgrounds. I certainly don't know what it is city by city. We have thousands and thousands of negative tests. We just get a lot of data in, and we just haven't had the opportunity to sort of analyze that beyond just very high level numbers so far. We'd like to, but we're just not there.
Thank you. Back to you, Don, or whoever wants to ask the questions in the chat.
Jody, do you have any questions?
Sorry, I was trying to follow along. I can look real quick unless anybody else has questions on the panel.
No, but there are more questions for sure. Let's see.
Any chance? Well,
go ahead, Jody.
There are plans. This is from our mayor, Livermore, John Marchand. There are plans for outdoor car shows in the fall. While well-attended, social distancing is possible and masks could be required. Do you anticipate something like this could occur if rules are enforced?
Yeah, I think it kind of depends on where we are with the epidemic in the fall. I think outdoor activities again are so far it seems like that's less of where we see transmission. So if there are things that can be done to limit groupings of people, that's going to be the most important approach. And what that means for car shows, I'm not, I think a good plan would have to be in place to do that, but it seems like there might be a way forward. Again, depends what's going on more widely.
I have a couple of quick questions that I see in the chat. Hair salons in Alameda County, when will those open?
Yeah. So well, again, we're not putting time frames on. They are kind of in the next stage or wave of reopening, and some other counties have opened those personal services. Some are, maybe asked to close them back down again, but or delay their reopening. I think, like in San Francisco, they've had to delay reopening those sectors. I'm hoping that we'll learn more, and because of it's small numbers of people that we may be able to proceed and get them open in the kind of next wave. I just don't know when that is.
Okay, and then there's several on like businesses, privacy issues. If you have a employee that admits to testing positive for COVID, is there privacy issues, and who do you report to? And then there's another one that says businesses requiring testing by returning employees. So those are kind of two questions, similar idea.
We are requiring businesses as part of their reopening plans when they are reopening to report cases to us. And so there's an expectation that they'll be aware of at least some cases. Not every employee is going to share. It's going to be important for businesses to protect the privacy and confidentiality of their employees. And so you have to strike that balance between, making sure appropriate measures are in place, communicating that there has been COVID in the workplace, but not sort of pointing to a specific person. That can create some problems. And then in terms of testing, there are situations where if there was a lot of COVID associated with a specific workplace, we are going to be asking employers to, arrange testing for their staff or refer staff to be tested, and to share that information with us. And partly because not all of those staff are going to be Alameda County residents. So in order for us to work with a specific business and make sure that they're taking appropriate action to get things under control, and we're really going to be asking a lot of the businesses. I mean, it's going to be, there's so many businesses in Alameda County. We're not going to be hands-on with everybody. But not, we're not going to know necessarily right off the bat every single case because they might live in a different county. And so there is going to be a role for businesses to try to collect some of that information. I'm not an expert on HR or employee law, so I can't speak to what employers can do under the law. We certainly would defer to any legal restrictions that employers are under in terms of how they handle HR issues.
All right, Dr. Moss, there was a a question about leisure travel coming back to the Tri-Valley and to Alameda County. When do you foresee that opening back up? Because our hotels are, as you can imagine, getting really hit hard right now.
Yeah. I'm not putting a timeline on things right now, and I understand the desire to get that back open. I understand when Napa is sort of further along, and customers are like, well, I'll just go to Napa because it's open, and Livermore's not. I understand that really presents a lot of problems. I think things have really changed in the last few days, somewhat in the wrong direction in terms of where we are with the pandemic in California, and so that's really, I think, that's again really made it so we're going to be very cautious, and I simply can't put a date on when we would get to that place. But certainly, I think that some of those things can be done in a way that's relatively safe, and hopefully we'll be able to get there sooner rather than later, maybe before the warm weather leaves us.
I have a question here from Loretta Buck. My business is an indoor go-kart racing in a 60,000 square foot space. We can very easily maintain 6 foot distancing. We don't fit into a category. I'm not sure what guidelines we should follow. Roll-up door docks can be kept open to make it an indoor-outdoor airflow. Our fans pull air from outside to ventilate fumes, so there is constant flow of air. What do we follow for reopening?
I do think there's some guidance around sort of entertainment venues in general, and I would encourage that the business to reach out to our COVID recovery team at Alameda County and just see what guidance would apply to them right now. I know there's a lot of businesses that kind of, it's not quite clear where they fit in. And so we can try to help point people in the right direction. And we are happy to try to do that. Again, that's, I think Eileen is put the email up on the chat box again for people who are looking.
Maybe one more similar question for weddings. There's a lot of venues that want to hold some outdoor weddings versus indoor weddings. Any guidance on that?
Yeah, so there are some permissions around religious and cultural ceremonies, particularly, and I think outdoors is going to be safer. And so I believe weddings would fall into religious and cultural ceremonies, and so there's some opportunity to have those. And I'm not sure that we have specific guidance around sort of how that works with food and certain aspects of a wedding, but there should be oh, and I see Eileen's posted the wedding guidance that we have, so I would refer folks to that.
Excellent. There are more
But I
questions.
invited Eileen to be here. She has all the answers.
So are we still good, Dr. Moss? I know we're at the.
I'm happy to stay a few more minutes. I think this is an important conversation, and I know it's a lot of we're not ready yet, but.
I have a follow-up question to the hotel. Where does it fall on the reopening phase document for hotels?
I have to look and see, have that open in front of me, and it might be worth looking at the states page, because that's really going to be the determining factor. It's forget what that page is called. Eileen, could you also maybe post that in the chat box? And it has the states kind of sector by phases for sector reopening, and it'll say where hotels lie on that framework. And their state also, I believe, has industry specific guidance for hotels once they are open.
So on the hotels, Dr. Moss, so it is still essential travel only for hotel stays?
In Alameda County, I believe that's correct, that for hotels here, it's essential travel. We're also, we work with hotels for some things related to COVID. But I think the recent questions we've had about sort of more leisure travel reopening are when they will move to that more sort of broad use of hotels.
Okay. And then we have a question here from a Pleasanton council member, Jerry Penton. Will the county be sending inspectors out to monitor restaurants for complying with the protocols to be open?
Yeah, I think a restaurant, there is a Department of Environmental Health does some reopening inspections, and they've been taking the lead on that for our county. And then in certain situations, if there are, there's like a substantial outbreak in a food facility, we would also go out and just make sure that procedures have been implemented to protect the workforce and customers. But it's in general, I think it's going to be, the in-person will be focused just on reopening. I believe they're doing that for, I think for all reopening restaurants. Quote me on that.
Okay. And then, the Tri-Valley is home to many, many people in the science world. We have physicists and scientists here, so I have this question. And it relates, I guess, to your dashboards, but takes it a step further. Does Alameda County have any numerical simulation capabilities to help guide decision-making?
Yeah.
How does it depend on others?
Yeah, I've had this experience before. You go out and speak to a Tri-Valley audience, and everybody in the room is smarter than you are and knows more about science and biology. So we do use the mathematical models of the pandemic to help make our decisions, and actually we actually run them ourselves, but they're built by other people. So we use some of the things that are available on the internet that people can see. And now the state of California actually has a web page that collects a lot of them, the Johns Hopkins University models, and a group called COVID Act Now that have models. So we look at those models that are, I think it's the CalCat website run by the state. So we look at those, and then we run an additional model that's available. It's a publicly available model on GitHub called Lemma, L-E-M-M-A. And we plug in the parameters, what we're observing, and some things that we think are true of our epidemic currently, and we look and see what the models show for the future. And we actually do want to start sharing that information on our dashboard in some way. A bit of a work in progress there, but I certainly encourage people to look at the state site if they want to dig deep into models. The thing about those models is they are good, and the person who asked this question probably knows this, but for the whole audience, you can't predict the future. So the models are giving you a variety of possible outcomes based on, or a range, I should say, of possible outcomes based on some inputs, what we're seeing in terms of our cases, and some guesswork. So there's a lot of uncertainty in them. And we look at many models, several models, in order to kind of get a sense of what reality might be. And what they generally tell us is, we could see a surge later in summer. I mean, a big surge, like a New York City kind of surge, later in summer or early fall. And the slower we go, the lower that surge is, the more we can protect our residents and our healthcare facilities. But the exact time frame, I'd say, varies depending on what inputs we use when we run those models. And so I think it's important for people to realize that they are useful, but they certainly don't tell us the future.
Dr. Moss, there's a lot of our businesses, not a lot, but a few have had issues with people coming into their stores or their restaurants not wearing their masks. And there was a question about any suggestions on how to deal with that in a non-political way.
Yeah, I think I agree. Non-political is right. It's just it's like a health and safety issue, like asking kids to wash their hands at school. It's not. We would love, from the health department standpoint, to get away from this as a sort of a political statement, because it's effective and it's easy, it's accessible to a lot of people. Some people can't wear masks for good reasons, and that's okay. I think the regulations are designed so that if you have health issues, that's sort of, you don't have to wear a mask. And this is temporary. It might be a while. We might be in this reality for a while, but we're not going to be in it forever. And so, I think it's just something that we're asking, we are requiring our residents to do to protect each other, neighbors, family members, older residents. And so we would love to get away from the sort of political discussion. And I understand that's tricky for businesses. I think it's important to just reiterate that it's about health, and it's about protecting neighbors, other customers. From a business standpoint, you just want to make sure that customers can feel safe going into your business and that they're not going to be at risk. And it has nothing to do with ideology. But I understand it's an ongoing challenge.
Thank you.
There's a couple of questions that are kind of getting into not necessarily business, but just family. What would let's start with the business one first. There's one about a prediction for social distancing into 2022. What is your prediction for need for social distancing outdoors into December? Jeannie, I think I'm saying that right, is running a Christmas display and trying to determine what we need to do for this year. Is a walk-through outdoor display with lots of guests coming through in a line possible? Do you have a prediction? Should we
Yeah, I mean, I don't like predicting the future, but I do think it's prudent to plan for some of that social distancing. So outdoors, spacing people out, that seems like a pretty reasonable approach right now. You know, having people come in family groups, household groups, but not, you know, just packs of friends, that kind of thing. So encouraging visitors to come with their household. Those would be my my suggestions for planning right now. I don't know where we're going to be in December. I think we're still going to be emphasizing social distancing, physical distancing, I should say, as much as possible.
Okay, great. So plan for a virtual and more distancing, but still potentially having the event?
Well, I think, yeah, I mean, virtual is always very safe, but potentially in-person events, again, outdoors with, you know, where in a way that people can have distancing. I think that's, you know, that's a reasonable thing to plan for right now. But again, you know, we just don't know what things are going to look like in December. My worst fear is that we have lots of COVID and lots of flu, and people are going to be, you know, really dealing with that. But I honestly don't know. We may see a surge in COVID before then, and we may know a lot more by then about what can be done safely. Outdoors does seem to be, as of now, outdoors seems to be a lot safer.
Okay, and then the personal one is, what is your advice for visiting parents in a memory care facility under hospice care?
Yeah, so I think we have guidance for the facilities in terms of how they can manage visitors, and there are some limited circumstances for visitors coming in. There's also outdoor visitation that I believe is permitted. We've asked nursing facilities, so you know, there's lots of different categories of facility. We've asked nursing facilities to have some plans in place to ensure the safety of their populations. And I think some memory cares are falling into that as well. And I believe that the state has issued guidance that once these plans are in place, depending on what's going on with the facility, certain types of indoor visitation could happen. There are some detailed restrictions about this, and I would ask the facility directly, because if they don't know the answer yet, they should be working on it. But I do believe there are provisions for outdoor visitation. Obviously not for somebody on hospice, you know, that's not always easy. But I also think there are exceptions depending on what's going on with the person who's on hospice. So important to work with the facility on that.
Okay, thank you.
I have another question here. With the recent outbreak, is there any way to pinpoint where those are coming from? Is it coming from businesses reopening, maybe social gatherings, or the protests or anything? Can you guys pinpoint that? Or
yeah, in Alameda County, so it's, you know, I think people see different things in different counties because they're at different stages of reopening. Here's where our epidemic is. It's in essential and frontline workers who went back to work, you know, before the rest of us, and are in particularly in quarters where it's difficult to social distance. And then in households, it spreads very easily in households. So a lot of our cases are household contacts. Particularly, we think in households that are more crowded, more people, fewer rooms, which is some of why you see the epidemic playing out in areas where there's just more households like that in the county. But those people are going to work at a range of different settings. Certainly, healthcare facilities and nursing facilities continue to be a real front line in the pandemic, particularly for a more severe disease, hospitalizations, deaths, that sort of thing. And then more recently, we've been looking for a signal from the protests, and we haven't really seen that. You know, we interview or attempt to interview everybody newly diagnosed with COVID to find out where they got it. We ask about mass gatherings of protests. That has not emerged. And maybe because people don't want to share that information with us. But we know this has been seen in other places. There was a story about New York City today. They haven't seen it. Maybe because those are outdoors, maybe because some people were in masks, or a lot of people were in masks, or there just wasn't enough COVID already in the population of protesters to spread around. But we just haven't seen that be as much of a driver yet. Could be delayed because the people participating were younger and they're less likely to get severe disease. So we're still asking those questions. And then I will tell you, people going to parties where they're not social distancing and they're not wearing masks, COVID spreads in those settings. And we're seeing that. That's being seen across the state. You know, if you get together in groups, you think, you know, you don't need, it's not a big deal, COVID spreads. It's really hard to prevent that. So yeah, so parties, unfortunately, I know people want to get back and socialize with each other, but that's been an issue.
Okay, and Dr. Moss, again, there's another comment about, would you ever consider opening things faster in the Tri-Valley than the rest of Alameda County? I know that you answered this question earlier, but if you can just reiterate that in a way that's maybe a little clearer for everyone who's
Sure. Yeah, so we're not planning to do that because the businesses, the workers and customers of businesses in the Tri-Valley come from across the county, and so even though you may not see the impact when you look at our map, I think the impact is there, and the risk for spread is real when you're, you know, if you have everybody in the county going to one neighborhood to recreate, and we still have a lot of COVID around, you're going to get spread. And so so we're really taking the county as a whole, and I think that that's going to be the most important thing for public health. And I would not look to what's happening with other counties as an example of what we should do here, because to be honest, it's not clear to me that that's working out that great. And so, just because Contra Costa opened faster doesn't mean that was the best thing for, you know, Alameda County's public health. And I think, so I wouldn't look to that and say, oh, we should open the Tri-Valley faster. I do think that it just doesn't work that way, unfortunately. I wish it did, but it doesn't seem to be that that's working out the way we'd hope.
And
Can I ask one last question? We have a couple people that are asking about if the county will be sending inspectors to monitor restaurants and businesses reopening, and if they are complying with the protocols.
Yeah, I think I mentioned this a couple questions ago, that I believe our environmental health inspectors are inspecting reopening restaurants, and I'm not sure if there are certain ones or some exceptions to that. They're a little bit more of the experts on that than I am, but they're certainly doing that. And then the other time that they might come out is if there was a large outbreak associated with the restaurant, to make sure that, you know, the right things are being done to get it under control. And I just looking at the time, I really should drop off, and but I really appreciate the discussion. I'm sorry that a lot of my answers may come off as, you know, bad news. We're not about to reopen a bunch of stuff, and you know, I hate to be in this position, but we are still really very much dealing with a severe epidemic, and unfortunately, things are not stable and under control right now. So we have to continue to be careful. And I just want to thank everyone from the chambers and all the residents in the Tri-Valley area, and all county residents, for the sacrifices they have made. Sometimes it's hard to see, but you're protecting the health and safety and saving the lives of your family members and your neighbors. And I'm very grateful, because you're all doing the hard work.
well, Dr. Moss, thank you very much for being so generous with your time. We're hopeful that we can continue our conversations and our partnership with you and your office going forward, because obviously this is something that is constantly evolving, and keeping our businesses informed with the latest information is critical. So again, thank you. Hope to see you soon.
Thank you so much. Really appreciate it.
Thank you. And for the rest of you, if you want to continue to stay on, we've got a few more minutes that we can field some questions and comments that we can send off to, if we can't answer them, send off to Dr. Moss and his team for response. But I appreciate Eileen Ng posting all of these links here in the chat room for our reference, which we also include on our Recover Livermore page on our livermoreupdates.com website. Jody, can you tell us, can our attendees copy or keep the chat section of this? I know we'll have recordings that people can refer to later. What can we do here?
Right. Yeah, I'm trying to copy everything to a Word doc right now. It's weird that it doesn't really work that well. So I'll keep trying. I'll take screenshots.
Okay.
I can jump in on that one. There's 3 little dots in the bottom corner that says Save Chat, and it will save it as a text or a Word document.
On the person.
Yeah, and the recording will also show all of the chat and all those websites as well.
Mm-hmm. Okay, super. And I do want to thank Jody Amos from Amos Productions, who's produced the webinar today. I think this has been very helpful. I hope everyone who's attended, who's still on here, found that's beneficial. We may not have gotten the news that we would have liked to have heard, but you know, that's not surprising. And we will circle back with you. I don't see any more new questions or comments coming in for the panelists that are here. Yes, we see interest in people wanting to have Dr. Moss back. That's great. All right, so do we have any final comments from Chair Kimberly or CEOs Steve and Inga? Kim?
No, thank you all for being here. It was great information, and thanks for sharing your morning with us. And Dawn, are we going to have an update in a couple of weeks on our regular format?
Yes, we are tentatively looking at July 15th for just a regular format of Business Alliance. So do you know, check out your e-announcements that come from the chamber for that.
And I just want to thank you, Dawn, for including us. This was really super, and the timing was impeccable with Dr. Moss stepping up. So thanks for including us. This is really, really helpful. And building that rapport with him is huge.
Ditto. Ditto for the chamber, Dublin Chamber as well, Dawn. Thank you so much.
Well, you're all welcome. And I think going forward, we will continue to do this collectively as a group, because we are, you know, we do work closely together, and our customers, our businesses, business owners, our suppliers, you know, live beyond the borders of our individual cities. So working together is critical in order for us to, you know, I can't say defeat, but manage this virus. The virus is the enemy. So we just need to work together and support our businesses to get through this period of time. So thank you all for participating. Again, we will post this as soon as the video is ready to go. So look for that. All right, if there's nothing else, thank you, everyone. Thank you, Jody.
Thank you.
Jody,
Thanks, Jody.
I was
Thank
able to save the chat and copy the Q&As, because you can't save the Q&A, but I copied it.
Oh, great.
Awesome.
Happy 4th, everybody.
Oh, yes, it's the holiday.
That's right.
Take care, everybody. Be safe.
Yeah.